Hello everyone, welcome back to my YouTube channel. And today is a very special vlog because I'm going to another workshop, and these workshops are divided into 4 days. And today we are gonna do workshop on surgical skills basically, and then we also have the observerships in last 2 days. So let's go and I will show you everything in further clips. And one more thing, it's so freaking sunny outside that like literally it's 30-degree outside, and it's almost similar to India's weather, you can see. And you know what? In this house, there is no AC and no fan. I'm so exhausted, and I hope that the venue has central AC. Oh my god, please. Let's go and check out. I have to reach in 10 minutes. Okay, let's go.
Organization. When I was a student into the State Medical University, there were the student management for the whole university. And they did let us do CPR on the manuals. But I was trying to show my best skills, like for him to copy, they started also with his surgery. And residents usually don't have to do a lot at the beginning of the phases, just keep the one open and that's all. It was a young girl, 20 years old girl, patient. Patient had intestinal obstruction. Closing. So it's super quick, but it took us 10 minutes to solve this bleeding. So we lost a huge amount of blood. And we narrowed the right iliac vein so that in the next 1 degree central poses of the vein, we almost amputated the right leg. Great patient came to us with intestinal obstruction, factors just for retracting the skin and nothing else. Because this sharp retractor, if it will touch the muscle, nerve, vessel, it will tear them. As you see, this retractor is absolutely blunt. It's absolutely not sharp, so it can be safely used to pick up the liver and retract the liver. Just press it, it's open. Press it, it's closed. So just this movement. We are also glad these are just tiny tips of the instrument inside, and it's absolutely not blocking your tube of Dolby or T. Also, curved tube, you can again encourage into this. We insert into the body part, and we ensure that it can easily go in the duodenum. So we pump it in the duodenum. It fits inside the duodenum, that this body can also go easily. That's what the movement is. So we insert the thread again, so we can surround the tissues and isolate any tissue without harming and tearing any other layer, any other organs. So, for example, the vessel can gently isolate and have it isolated. For example, I frequently use this instrument to isolate spermatic cord when I do open hernia repair. We can give it to obese patients, they need food from it, they get tired, they throw it, they quit eating and lose weight. Or we can use it for debridement. So, up to you, you can use it for both purposes. So, actually, this is used for debridement. The wound, usually it's open wound, it makes biofilm that we need to remove. Correct. Tubes. One is inner tube, which has got just 3 holes on top. Or if you insert, this is connected with a plastic tube to the suction machine vacuum. And once we insert it in the cavity, let's say the abdominal cavity, these holes can be easily obstructed by abdominal organs such as momentum, bowel. If it's obstructed, nothing goes inside and you simply have to remove it again, reinsert it, it's absolutely not comfortable. We can insert it into the second tube, and in the second tube, as you see, it has got multiple holes right here. If you insert it in the abdominal cavity, even if the majority of those holes are obstructed, some holes are left free, fluid goes inside and is aspirated by an inner tube. Okay? So, this whole suction tubes have just one hole. This is used mainly on the face. Tear the blood, tear the soft tissues, lead to pneumothorax, hemothorax, many other problems. So we have to cut these sharp edges, or there can be an issue when tumor of the lung is invading the ribs, and we have to resect the ribs. So this is our use for cutting the ribs. Okay? Adult ribs and children's ribs. These nice instruments are used for holding the bone. You need to hold the bone when you do amputation or osteosynthesis. This one for bigger bones or smaller bones. So you can see how huge it can be, and it can hold the bone very tightly, and yeah. So at the moment it's wrong, but we still can show you how it works. So it can give us possibility to use these assistance resources in other parts of the surgery. Okay, like joint the wound, tying the knot, you may insert additional retractor, so it makes it more comfortable. The same retractor, but with bigger tips and flexible tips, so we can adjust the wound edges and based on it, open it, for cutting the bit bread. Actually, this one is used for amputation, but I have never used this type of retractor instrument for amputation. We use jiggly saw for amputation, or we use electric saw usually. So here it is. I insert without moving and do whatever you want to do. Any 9 stitches, moving, pumping. So what we do is, in these situations, we fix it between our 2 fingers, and we simply arrest part of the heart while placing a stitch. Even if it will stop, you need to do it. If it stops, you start pumping the heart. Take the needle out, let me go outside in. Take the needle out, and tie it out. Slowly absorbable monofilament material, which is BDS. BDS is absorbed in 6. What we do is trachea. First of all, we need to fix all 4 edges. Again, when we put the stitch, one important issue that you need to consider is that the knot should be outside and not inside. It's very important. So once we place the stitch, we don't use very knot in this situation. But the knot should be outside the wound. The same happens with the vessels, the same happens with many other bone organs, including bile, including intestine, and so on. The knot should not be inside. Interrupted stitches. On this side, on the opposite side, can go through the cartilages. distance between the stitches should be approximately 2 to 4 millimeter. This way, the change the direction to 4 millimeter. So take a look. Okay, stitches.
It's over now. I'm heading home, and it was so interesting. Tomorrow the venue will change, and tomorrow it's in the evening, so it will be from 3 to 7. Let's go. Almost there, and मैंने आते आते एक वेजी रैप लिया है from Indian Cafe. So let's taste. So we have mixed chutney, and we have faster than paper cover. तब तक मैं अपना एक्सपीरियंस बता देती हूँ. आज डे 1 था ऑफ सर्जिकल वर्कशॉप, अनदर सर्जिकल वर्कशॉप, एंड बहुत ही मस्त था. हमने बहुत सारे सूचरिंग टेक्निक्स सीखे नए नए, एंड ऑल्सो हमने टिश्यूज़ पे परफॉर्म भी किया, लाइक हार्ट, ट्रैकिया, एंड ऑल्सो टेंडन रिपेयर हमने किया, विच वर लाइक पीस ऑफ पिग्स. यस, हमने ये सब चीज़ों पे आज सूचरिंग सीखा, एंड बहुत इंफॉर्मेटिव था. एंड टुमारो वी हैव अनदर वर्कशॉप, एंड वो है शाम को, तो मैं आपको दिखाऊंगी. आज के लिए बस इतना ही. बने रहिए मेरे व्लॉग में, एंड स्टे ट्यून्ड.